Hey, welcome back. So part 2. So in this, now that I scared you about the intravenous, let's talk about the other option. And I'm going to talk about them in the order that I think you should consider them. There's basically kind of 3 and let's say 3A. 3 ways of giving them. And we'll talk about this one on the other. Actually, here. Yeah, there you go. So 3 is kind of separate in 2. So the first one is per mouth. And this is your first go-to. The reason why, it's easy to do, it's easy to mix. There's tons of stuff you can already prepare, or there's also things that you can buy to prepare them. There's tons of recipes, and there will be a link of a great website with all different recipes and stuff. And you can make your own at home, and this is the advantage of this versus the intravenous that you can have. So that means you can do that stuff. So if you have salt, sugar, sometimes some of them will have, in recipe will have lemon as well, you can do your own mix at home. All it needs to do is don't overdo it, and as well as again, there's no such thing as there's no poison. Water is a poison as well. You can drink too much water, and the water that you drink, this is the thing, is that it has to have some electrolytes inside, because the problem is that if you do not have electrolytes inside, so oops, let's move that for a second. So let's say this is our stomach, and in between here is a cell, and this is our vessels, and this is this is our vessel. So the fluid comes over here, and let's say you have only waters, and so the when it goes from here to here, our cells has some channels sometimes. So the sodium, your potassium, your calcium, magnesium too, and sugar, all those have to go through, because they won't go directly. They have to be managed by little pumps that decide, a little bit like guards that decide who goes to where. And they affect as well as the water. So if my sodium goes up here, then more water will try to do this to dilute it, and or this pump will try to stop slowing down to decrease how much sodium goes on the other side, so that way there's not as much over there. But lately they always thought that that's what it was, only for management of the water. But what they're discovering now is that the water has its own little passage. And so, add to this that the sodium and the sugars are affecting the water, how it goes. The water can go through directly. And so what happens is that if this intravascular compartment goes too big, it goes to your kidneys, and then your kidneys going to go do is like, hey, I got too much fluid, I need to get some out. It will pee. So basically all you're going to do is all that fluid that you're getting in, you're peeing it out. But if you put some electrolytes, then you'll be able to have a pretty decent comparable zone in between the extracellular and the intracellular, and basically now the body won't react like this, like urinating and stuff. So that's why the PO is very important. You don't need to go too crazy. Just follow the rules with the, so especially if you're vomiting, if you're having diarrhea. Good mix that you can buy already and have always at home and stuff, and always have a bottle of this, is Pedialyte. That's the kind of stuff we give to kids. So it's great for kids, great for adults, but again, be careful. Some of them, if you have any cardiac issues or renal issues, then don't be careful about them. Just talk to your doctor before you take them. You can make your own at home. And let's say I have like a problem, and we'll do a series pretty soon on diarrhea. If you have an issue with diarrhea, you're losing a lot of water, or you're vomiting a lot and stuff, even if you take the Pedialyte and you're able to keep it for 5 to 10 minutes, it's already been absorbed by your body, and so the electrolytes goes through it. So that's one of the big advantage. And when we're talking about pure, we're talking about fluids. You stop the food, or you go to certain kind of foods. And again, in the website, they'll talk about it and stuff. But the congee that I talk in previous videos, where basically it's 2 parts. So rice that you take let's say you take 2 cup. Well, you have to put 12 cup. So it's 2 to 12. So for 2 cups, you put 12 cups of water, and you let it boil for about 3 to 4 hours. And what's going to create is kind of almost like porridge, and it's great for that stuff. It helps with the absorption in the stomach and everything, so it can be a good source of, and that's why I always have now in the freezer to conserve very well, and it can be a good source for pure resuscitation. But right now we're going to stick to the fluids and not really talking about what kind of food you can give to people, but follow the recipe. But now, if the person cannot drink, either because they're unconscious or their level of consciousness is a bit, the other one that you can give here, or they're vomiting a lot. And an NG one, sometimes it can help if they're vomiting, depending on what's the cause of it. But the other one that you can give is what we call a nasogastric tube. So basically what it is, it's a little tube that you put down the nose, or so nasogastric, so it goes to the stomach. You can also have what we call an OG, oral gastric, so you pass through the mouth. But to be like this, that means the person have totally to be unconscious about that. Those two, you can provide some fluid to the person. And when I used to work in the ICU and we had burns patient, we used to feed them through a little catheter that we put in their stomach and give them their food that way. Because the problem is with the stomach, because you used to give them intravenous, and we talked about that before, but what they found out is that if the stomach doesn't have something to chew or to activate, because we do have a lot of bacteria inside the stomach, will open and get into the bloodstream, and they'll create a bacteriemia of the blood and stuff. So that's why we were feeding people through the tube and stuff. So you have to be careful with those, and again, I will let you do your own reading and research. But if you have a nasogastric and a neurogastric, that's another way that you could, so you put that tube in, and then you could inject some fluid, or just give them if they're not able to swallow and stuff. If you would be unconscious, then that means this person obviously would have to be kind of on sitting positions and stuff, and be careful that they don't aspirate. So that means that the liquid comes from the stomach all the way up to the lungs. So then, if we're really, either we're vomiting too much, or we're so unconscious that those solutions are not, then we get to a number 3. And the number 3 is actually 3 and 3A, or 3A and 3B if you want. And those ones are rectal and subq. SQ like this means subq. Yeah, so so rectal, and we'll put some research in. It has been proven and it works. So the difference with this one, the advantage is that you can give it to pretty much everybody. You don't need some sterile techniques for that. And on the third part, we'll show like some tricks of the trade of what you can use for that. And the advantage is you can give pretty much the same thing that you would give in IV, but you would give it intrarectally. Obviously, if they have major diarrhea or whatever, it'll become a little bit difficult to give any fluids. And also, if you give the fluid too quick, that becomes another issue because now what you're creating is an enema, and the difference between the rectal fluid administration versus an enema is pretty much either the quantity and the speed that you're giving them. So you have a certain speed that you need to give, and if you give it too quick, then basically your stools will be changed into diarrhea, and you'll have major diarrhea. So you have to slow down the fluid that you administer so that the gut can absorb the water instead. And pretty much, I'm sure everybody heard that story about that nurse that was in, I think, a boat, and she took like water that was not too clean and was administering her rectally and stuff. But the one that I will put out is actually a case study where the person was on stuck in the mountain, I think in Nepal, and they were unconscious, and they were able to keep them until the supports were coming. So that would be another one that would go to. The 3A, the 3B one is a subcutaneous IV, and a lot of research has to be on that. And cholera, actually there was a big cholera outbreak in 1893, I think 94, and there's some articles on that and stuff. And they started to give the fluid into the subcutaneous. The advantage of this one, you can give it to kids, but also to animals. And animals, that's a big one that they can give. So that means the material that you can have, obviously, if you use it on an animal, don't use it on a human after that. But the advantage of this is that if you have a dog or something and you learn this technique, that means that you can administer the same kind of fluids that you can on a human being on your dog, and you can read about that. And so the same technique now can apply to adults, kids, and animals. So it's a very useful technique to learn. It's a very low knowledge, so that means it's very easy. So basically it's as simple as taking the skin, not here, but you would take a fold and basically just put the needle in. So that means with the right needles you can inject your fluids through it. Now the big question is that most of literature is pretty much because you're still injecting something through the body, so you're injecting under the skin. It's not as it still need a septic an aseptic technique. Sorry, when you insert it, and pretty much everything has to be as sterile as you can. But I will leave you on the decision: can we create our own fluids for administering subcutaneous? There's an article that I found, and it's actually from a medical journal from that cholera outbreak, and they were making their own fluid back then, so now non-sterile and everything, they were injecting it. So it is to your decision, but obviously this one is better. So if you have the same bags that you have intravenous, that would be a technique that you could use, and with the same material pretty much that you have. It's just the needle is smaller and it goes under the skin, and I'll have a video and some other links on how to administer it and everything. Can you mix your own? That will be your decision to take and decide, and risk versus benefits of whatever you are. But right now, in a lot of places, especially in the UK, starting a little bit more here in Canada and a little bit in the States as well, in palliative care, nursing homes, they're starting to use this because it's not as invasive as an intravenous. The technique is low practice, so you don't need to be as skillful to start because like I said, you just lift it, fold, put it in, and you give the fluids. So it's a very easy technique to remember, and even if you don't have much practice, it's still very effective. I'll have another articles on they study it during a mass casualty incident, so that means you can still give fluids for resuscitation on a very fast things, and you have to carry less material than you have. So those would be my 4 ways that you can give As you can see, intravenous is not on my choice. Those would be the 4 ways that I can give that stuff. And I'll encourage you to read a little bit more about, and those links that I'll put, they'll have way more information. So let's go with part 3.